Hey everybody, I am Diana Braun from the Knee Zone. I'm joined with my husband and expert surgeon, Dr. Raj Sinha. And those of you who are in late stage and have some really interesting questions here. So we're probably going to spend a little extra time on these. So late stage is Yasmin, Sandy, and Zelda. If you are here or watching the replay, these are for you. And we may actually use your first names. Because you have some very unique cases and we want you to be able to pick up on it. So where are you going to start?
We'll start with Zelda. Zelda's a year out and initially was doing well, but is now starting to lose flexibility no matter how much exercise she does. And she's concerned, even though she's seeing a physiotherapist. So the first thing I would say is, are you overdoing it? Because there is such a thing as overdoing your recovery. Sometimes, the knee just needs to rest. Now, a year out, still struggling concerns me, especially if you're losing flexibility. It basically falls into a couple of different categories of why that happens. The first thing that I would rule out is infection. It could be what we call occult infection. It's not the obvious thing that you're used to, like, pus is draining out of a body part. That's not what happens sometimes in artificial joints. You can get something called a biofilm that forms around the implant, and you don't see pus, but you have pain and stiffness and tissue thickening. And there are a bunch of different tests that need to be done to rule out infection. That's the very first thing I would do. The second thing I would do is I would look very carefully at the alignment and the rotation of the implants. Sometimes if they're slightly malaligned or malrotated, people can have late loss of flexibility. And unfortunately, the only way to solve that is to redo it. But a lot of people, once they understand what the issue is, will say, you know what, I can live with this. And then the last thing I would do is look at instability of the artificial knee. And a very small percentage of people, they actually stretch out because they have high levels of elastin in their connective tissues. And so they will stretch out over time. And then that knee that was stable before gets a little wobbly, and then your body compensates by stiffening everything up, and you start to lose flexibility. So those are the things that I would look at, or have your surgeon look at.
I'm assuming you would tell Zelda to go back and see her surgeon again and discuss this.
Certainly.
Yeah.
And, again, I think she's out of the. I don't know if she's out of the. She's in New Zealand. So
yeah.
I don't know what access to technology they have there, but I would get blood testing. I would take fluid out of the knee if I could. If there's fluid in the knee. Those are just to rule out infection. I would do a metal subtraction CAT scan that helps me look at rotation and alignment. And then lastly, I would look at a very aggressive physical examination that would allow me to determine instability. Okay, Sandy is 7 months out, range of motion, 120 degrees of flexion. It can straighten as well, but the issue is still feeling some tightness around the knee, and is planning to have another knee replacement surgery. Okay, where's a brace for the other knee? So the knee that's been replaced, the tightness at 7 weeks is not unusual. It's usually a sign.
7 months.
Sorry, 7 months. Thank you. At 7 months is not unusual. It's not common, but it's not unusual. It's usually an indication that your quads just haven't come all the way back to life. And so you need to do some emphasis on quads, particularly what's called the VMO, the vastus medialis obliquus, which is the inner side of your quad muscle and the muscle that gives you that power in the last bit of straightening out. So you need to focus on getting that a little bit stronger. That usually gets, once the quads get back to normal, that usually gets rid of the stiffness. When do you think the stiffness ended for you?
I mean, most of the time, I think most of my day-to-day stiffness was gone at about 9 months. Now, there are days, like sitting here right now with my knees really bent under this chair I'm on, my right knee feels a little stiff right now. I'm conscious of it. My left knee, I could tell you, like, I don't even ever think about it. Like, I can't even believe it was ever replaced. And that's, again, we've been sitting for 30 minutes and my knee is bent. I don't know how far back, at 130 something right now. Yeah. It's extremely bent. But if I straighten my knee out, I'm no longer stiff. I just got to move it a little bit.
Somebody asked a question about waiting too long. This is what I think my dear wife did. Her right knee was much worse than her left. When they opened it up, everybody was sending me pictures from the operating room as to how bad it was.
Again, stubborn, very stubborn woman.
And not surprisingly, it still gives her, the stiffness. It's not painful, right? You don't have to take any medicine for it.
No.
Just like you said, you're aware of it.
I think we have another question who's late stage from
Yasmin.
Yasmin.
So
Okay.
Yasmin is similar to Sandy, I think. She's about 8 months or 9 months out, still having some stiffness, but issues with bending. So my question is like, what's your flexion? I don't know if you're on here, if you can send us a quick note, but if you're 9 months out and you're only at about 60 or 70 degrees, that's a problem. If you're 95, 100 degrees, it's not ideal, but in the Western world, 95 degrees is what you need to do most activities. In the Middle East and the Eastern world, you need a lot more. We actually have specific implants that we use for those patients that actually facilitates their ability to get more flexion. But if you're 120 degrees, that's about what most implants are designed to do. Anything above that is gravy, and some surgeons even get concerned that if you have too much flexion, it's actually causing damage to the plastic. I'm not in that camp. I just think the plastics are too well made
Nowadays.
So I think that if you have more flexion, that's great.
Thank you. I hope this was helpful. We'll look forward to seeing you next week. And be kind to yourself and your knee. Knee replacement's hard. It's not easy, but it's worth it. I can promise you. Bye.